Hello, good morning, good evening, and greetings as participants. My name is Mohammed Naveed. I'm a secretary and PRO at the Global Room Pakistan chapter. I'm excited to be here with you today to present the Global Room Operating Pakistan chapter. I would like to introduce the Operating Room Global Pakistan chapter leaders. Dr. Tariq Zafar is our patron TORG Pakistan, and Dr. Raza Khan is a chairperson. Abu Bakr Khan is a vice chairperson, and me, Muhammad Naveed, secretary. Umar Khalid is a treasurer. Muhammad Usman is a membership coordinator, and Muhammad Akhtar is is a membership coordinator. Muhammad Akhtar is a special project coordinator, and Muhammad Bilal is a event coordinator. Today, our topic is infection control in an operating room, and it's presented by the Dr. Raza Khan. So I would like to some introduction about our the operating room global. The operating room global is a professional platform for the operating theater staff and all disciplines, both locally and internationally. Our participants and our memberships coordinators are surgeon, physicians, theaters and theater nurses, scrub nurses, registered nurses, and all type of health, allied health professionals, doctors, and many more. With a current membership of over 100,000 operating room professionals. Miss Edibusla Ovokolo is our TROG founders and president of the Operating Room Global since 2015. TORG is a professional platform for the operating theater staff for all disciplines, as told already. It's work with locally and internationally professionals. TORG was pioneered in Nigeria and currently has a membership of over 100,000 members, and our platform is a registered memberships, and it's work in almost 70 countries. Miss Eddie is a president and founder, and she is award-winning team leaders, editors, and certified pre-operative specialist, motivator, and high-skilled career professional with over 16-year post-registration practical experience in the operating room and the acute care. She is currently working in clinical nurse managers and pre-operative operating theaters at the University of Limerick Hospital Group. He is a theater charge nurse of orthopedics, trauma, elective surgery, and including spines, robotics, and advanced navigations. So without time wasting, I would like to invite Miss Eddie first. She's a because she is a president and our CEO. So I would like to invite Miss Eddie. Please over to Miss Eddie.
Thank you so much, Mr. Navid, for that introduction. I think everything has been mentioned about TORG in a nutshell. I'm excited to be here. At the moment, we have over 25 chapters, and Pakistan is one of them. We are really grateful to all the leaders in Pakistan for the commitment, for all the support, for all the efforts put into the fact that they want the chapter to keep going and succeed and attain all our goals and objectives. So TORG in a nutshell has been about collaboration, has been about knowledge sharing, has been about evidence-based practices. TORG has been about research initiatives and more, and even innovations in surgical technology as well. So everything we do centers around all those goals and objectives. And I'm so excited to be here to participate in this webinar and to listen to our chairperson deliver the lecture on infection control in the operating room environment. It's a crucial topic, and it's something all the leaders in the operating room environment need to look into to ensure that infection control rates are brought down to minimum as much as possible in the operating room environment, and everyone meets up with evidence-based practices, current evidence-based practices in relation to infection control in the operating room environment. So thank you so much to all our leaders. Thank you to all um, everyone working in the background and in the open. A million thanks to our chairperson for this privilege even to be here. So thank you and thank you. Over to you, Mr. Navid. Thank you so much.
Thank you so much, ma'am. So we now move forward to the topic infection control and in operating room. I would like to invite our TORG chairperson, Dr. Raza Khan. Over to you, Dr. Raza Khan, please.
Thank you, Mr. Navid, for inviting me.
Thank you, sir.
Today, we will discuss about the key concept about infection control in operating room. We have decided, due to the limitation of the time, as the infection control is a very vast topic, so we have divided this topic into two parts. In the first part, which is we are going to discuss today, we will describe the key prevention within operating room, and on the second part, for which we will announce later, we will discuss about the key advancement in infection prevention and infection control in operating room services. So as per the presentation plan, we have discussed about the TOR, the Operating Room Global. We also discussed about the Operating Room Global Pakistan chapter. And now we will, moving forward, we will discuss about the knowledge and awareness of the standard infection prevention and control relevant to the OR. That can be either operating room nurses, recovery nurses, anesthesiologists, anesthesia technicians, surgeons. We will discuss about the key concept like hand hygiene, the role of hand hygiene, PPE, management of blood body fluid spillage, SSI, surgical site infection control management, and the management of OR environment. So as Mr. Naveed and already discussed, that the TOR is founded in 2015 as a not-for-profit and non-political organization. And recently we have around 19 chapters all the world. Our objectives and key objectives are knowledge sharing and collaboration. We focus on education and training, and we bring the research and innovation in the field of operating room services. We also act as an advocacy for patient safety, and we are working to increase the global impact of OR society. Moving further, let's discuss about what is infection control. So infection control is expected to be a very key point, the heart of good OR management and the part of best clinical practices to ensure effective protection of patient safety and minimize healthcare associated or healthcare acquired infection. Effective prevention and control must be embedded into everyday practices, and it should be applied equally by everyone. All staff, all team members are equally responsible for infection control. Infection control is not a job of single person, not only the theater management, not only the surgeon or anesthesiologist or OR technician. It is a mutually or combined task of everyone who are working directly or indirectly in operating room services. From us as a theater team member, patients and their relative expect us to deliver environment where the patient are safe from hospital or healthcare acquired infection, especially surgical site infection, infection related to hand hygiene. We can achieve this task when all staff, all team members accept their responsibility for their role in ensuring good infection control prevention practices and adhere to the standard precautions all the time. Effective infection control involves implementing protocol to prevent the spread of microorganisms within the sterile and inside and outside the inside environment. This include proper hand hygiene, sterilization of equipment, and adherence to infection prevention protocols. Uh, let Before moving further, I would like to ask from the participant about the two key main concepts which are using in the OR very frequently. That is disinfection and sterilization. So, can anyone explain what is disinfection or sterilization? Anyone from the participant? You can raise your hand if anyone can give a small insight.
Yes. Hello.
Yes, Mr. Yusuf, you can ask, you can unmute yourself. Yes, Yusuf
Okay.
Muhammad.
Okay. Good afternoon. Good morning. Depending on your time zone. Actually, thank you for having this presentation. It's my pleasure to join this wonderful presentation. When you're talking about disinfection and sterilization is a complete removal of bacterial pores within the pores, making it thereby making it sterile, free from infection. While disinfection is reducing the extent of microbiomes or microorganisms within the articles or an instrument. That's it in brief.
Okay. Very nice, Yusuf Muhammad. So disinfection is a process in which we kill the most of the pathogens, but we don't disable their ability to reproduce, regrow uh, in in very next few moments, a couple of the time. So, while the sterilization is the complete disinfection, um, killing of all microorganisms that can be viruses, bacteria, spores, pathogens, and it also uh, kill their spores. So this is the two concepts which we very frequently used in OR. Both are very different. Um, we will discuss in next slide. Okay, just give me. So, what is the chain of infection? The chain of infection involves a series of events. As generally, infectious microbes, pathogens like bacteria, fungus, viruses, parents, protozoas are attacked on and search for a reservoir. When they found a suitable media environment, they replicate their cells. And when they combine in a certain quality, certain quantity, then they transmit on the patient, then on patient or health care workers. And they search for a portal of entry, and then they attack on suspectable host. They can be patient, they can be healthcare worker, they can be staff or doctors, which are prone to infectious risk. That is non-immune patient, babies, adults who has. So it can be anyone. So we have to prevent this chain. We need to focus. We need to keep in mind this chain of infection, and we need to break this chain to prevent the spread of infection. So first thing, very first concept is uh, in the OR is hand hygiene. When you are entering in the OR and when you are exit from the OR, the first key thing is hand washing. Hand washing is very necessary. It is not only necessary for the theater, it is for everywhere in the environment when we are touching, dealing with patients. As you know, there are 7 steps for hand scrubbing, 7 or 8 steps for hand scrubbing for surgical procedure, and for general hand washing there are 5 movements. Okay, I think this is all we knows, so we'll skip. The second thing, which is very essential to control infection in the OR, that is the use of PPE, personal protective equipment. These maybe gloves, the first primary thing. The second, apron, gowns, masks, face shield, like goggle, glasses, anything. Anyone can share any PPE other than that we use in theater? Yes, I would like to.
I think shoes cover like this.
Yes, okay, shoe cover. Within the theater, using. Okay, anything else? Now in the theater.
I think cap is missing here.
Okay, so head covers. So in theater now we are using face hood covers, hair hoods. These are entirely from gown to it includes mask, face shield, all thing like that. We will inshallah share in next slide in advancement in infection control slides. So the decontamination, third key concept is decontamination. It is very essential if we follow the cleaning schedule, that is periodic cleaning, uh, periodic cleaning, and just give me a minute. Sorry, sorry for disruption. So decontamination is very necessary if we follow religiously the cleaning schedule in our environment. It helps us to control infection, infection in the sterile and other field. And that involve cleaning of equipment regularly with appropriate solutions that can be chlorhexidine, glutyraldehyde. Other than that, hypochloric acid. And the cleaning, we should focus on OT tables, trolleys, dustbins, equipments, all disposable things, and patient-related accessories. And we should focus before the start of list cleaning. Between the two cases, the cleaning between the two cases are very essential and important. And the finally, the cleaning of the day end, that is also called terminal cleaning or the day end cleaning. So if we adopt these practices in our OR, so we can control around 60% of infection that is spreading from the OR. The fourth essential thing is management of sharps. As in current Pakistan, Asian countries, and in African countries, we are recent day nowadays are prone to Congo virus. So in this, there are many other infections which are spreading from the sharps. So the disposal of sharp on the disposable of shards in respective correct handling of proper handling is very essential. So we should do safe assemble and safe use. If there is any needle prick injury, we should report immediately and take first aid. To, and next, the reporting of incident, needle prick injury, sharp injury is very essential. If we report the events timely, properly, then we will learn from our mistakes that we should avoid these, like recapping, it should be banned. So what is SSI? Surgical site infection. Anyone? I would like once again from the participant, anyone have idea what is SSI and why SSI management is important in the OR? Anyone from Pakistan or African region?
Yes, Dr. Raza, can I share my input?
Yes, yes.
Thank you. Uh, as far as I know about SSI, surgical site infection is a major thing which can save or lose our money in developed or underdeveloped countries due to care or negligence of staff. If we take good care of hygiene and uh, chain break of infection, we can save a lot of money and the health of our patients. If we neglect this chain, which we have you already shared with us, then we can lose lot of money and lot of lives. You can
Yes,
summarize
exactly.
in
Thank
these
you,
words.
Rebecca, for sharing your insights. Okay, thank you
Thank you.
for your insights. So SSI is a very big problem, a big challenge in especially in low middle income countries like Africa, Pakistan, Asia, Arabic countries, and other underdeveloped countries. Okay. Um, WHO has took a lead and initiative to address this big issue. So SSI is purely related to the OR. It is after surgical site infection. If the patient has experienced any surgery or any skin incision, and then the immediate uh, infection which are grown developed due to these causes, surgical interventions, it is called SSI. So it is a very big problem in LIMCs, low middle income countries. In SSI, in the countries where the chances of SSI increased, they lost a very big portion of GDP on antibiotics and infection treatment. Overall, 19 billion euros in Europe, they are spending on SSI for the treatment of SSI. And you can imagine if there is the portion on developed countries, so how much we are expanding on this issue. So 11.8% of GDP, sorry, 11.8%, almost 12%, we have the infection rate. That is developed country and WHO data. You can imagine in Pakistan, there is around 27% SSI rate after surgery. So this is very essential. We should focus as a theater member, as an OR member, we should focus on this as a team member, as a nurse, as a doctor, as a patient care advocate. It is our key responsibility to address the infection. So the factors for SSI. Due to SSI, it may it increase. It can be to have.
Dr. Razafan, we cannot see your share screen.
Oh,
Can you
sorry.
share, please?
Okay. Can you hear me?
Yes, sir. No, perfect. Awesome.
It is due to the prolonged stay, antibiotic prophylaxis, and sorry. During the operative session, we should identify the right wound classification, like clean wound, clean contaminate wound, dirty or infected wound. So we need to follow the proper sequence after. Sorry, can you hear me? Or there is any distraction?
Yes, sir. Sir, please carry on.
I would like to ask participants. Okay. Thank you. So the risk factor associated in the theater are associated with the wound classification. We should follow the proper wound classification, and that is clean wound, classification of clean wound. If we are handling the clean wound, and then in a proper sequence, clean contaminate wound, dirty or infected wounds, like that. It is also associated with operative techniques and the tissue handling. It is also associated if the surgery is prolonged, take unnecessary time. So there is increased chances to have SSI with the patient. And if we are not following the standard precaution and the standard practices of OR. So we may have we can leave any foreign body in the patient cavity. So it also increases the chances of SSI. And anything like if there is patient have additional then the patient may prone to risk of SSI. And so there is so like how SSI occurs, how patient develop surgical site infection. As we discussed, patient has own microflora infection, or patient can take infection from the OR. Like from the staff, from the equipments, from the accessories, patient consumables, especially the reusable parts of OR equipments, surgical equipments, patient-related equipments, and it can patient can also take this infection from environment, from air. If theater has proper doesn't have proper HEPA filtration, air filtration system, air cleaning system. So patient has increased chances. As usually in there is unfortunately in Pakistan, in many cities there are in many hospitals there are no air filtration system in OR. There is no proper cleaning system in theater. There is no proper developed protocol for equipment cleaning, and if staff has not following the standard practices of hand hygiene, equipment cleaning, theater scrubs, so the patient, these are three key sources which due to which patient can take the surgical site infection. So what are the most important measure to prevent SSI? Yes, once again, and final, I would like to ask again participant to share your valuable insight on this point, how we can prevent SSI in our healthcare environments.
To make sure, first thing is to make sure to provision of sterile instruments and aseptic techniques. Second thing is
Okay. The first thing, Mr. Naveed shared that if
first
we
thing is
follow
to
the
yes sir.
standard sterilization and equipment cleaning processes. Okay. Anyone else? Anyone from African region? Okay. So the solution for is similarly to break the chain of infection. Okay. The patient, we should ensure we should develop the proper practices for the patient for before preoperative, perioperative, intraoperative, and postoperative. So before the surgery, we should ensure that the patient wound site is properly clean, and patient should take properly bath, and should avoid the practices of shaving just before or before the surgery, as there is increased chances to have skin cut or to give the chance of skin flora to enter in the skin, dermal layer or epidermal layer. So that is why we should avoid the skin shaving. We also should use the antibiotic, minimum use of antibiotic. We allow the patient to give antibiotic when required. We do not unjustified and unusual use of antibiotics. So as patient has the chances to resistant or so similarly we should use a proper classify proper solution detergent which clean this in fact skin like povidone iodine, chlorhexidine, or alcohol-based antiseptic solutions. We should um, use the hand hygiene and hand scrubbing practices for the surgeon, for the anesthetist, for the runners, everyone who are working in the theater. During the surgery, we should ensure all equipments are sterile, properly cleaned, all surgical instruments are sterile, and their sterility are ensured. Like if you are using the micropore papers, then the sets should be intact and sealed. If there is indicator is not present in the case, then we should report our CSD team to have indicator, to have a visible indicator to assure the sterility of the instrument. Similarly, we should have the proper air cleaning, proper air handling units. And similar, finally, we should restrict the entrance and exit in within the theater during surgery, as it disturbs the environment and air. And after surgery, we should use proper recommended medication. Do not use unnecessary antibiotics, as it also contributes the spread of antibiotic resistance. And we should use proper dressing, proper we pass on to the patient proper instruction for wound care, for surgical site care. This is the checklist which also WHO developed for SSI for the patient education. You may also take help from this. And this is the final like cleaning. This is an example for you for the cleaning after, before, and during surgery. Okay, so you can see where this is also the checklist of WHO for theater cleaning. In this you can see the purple color indicates every patient for that this equipment like OR table, IV poles, patient monitor screens, anesthesia machine, this should be clean, and the patient consumable should be clean for every patient. Okay, and light purple color indicates if use, then it should be clean. That is also similarly trolleys, additional accessories, and you can see the yellow color. If we use also clean these equipment, the mentioned with the highlighted with yellow color, so it may enhance the chances, it may reduce the chances of infection. Okay, and the blue is the day and this checklist is also available on WHO patient site to adopt effective theater cleaning practices. We will also share in our group as a resource. Finally, I would like to share the sustaining of infection control practices is not the job of single person. It is job of everyone who are working in the theater. It is not a task or a goal we can achieve on a single day. It requires a series of activities. We should develop an ongoing infection control practices, feedback mechanism. We should develop a feedback mechanism to give feedback everyone who are breaching the practices, policies, and it also required a sustainable um, a uniform commitment from everyone for CQI, continuous equipment improvement. And this ensure if develop a proper series, a proper protocols, and with uniform, consistent commitment, then we should ensure the best practices in our OR for the patient safety. So, thank you. I would like to hand over the mic to Mr. Naveed, our secretary, and for our TOR leaders for sharing their insight on infection prevention in operating room environment, in either that is pre-operative area, intraoperative area, and post-operative area. Thank you, Mr. Naveed. If there is any question, Mr.
Thank you so
Mr.
much,
Naveed.
Dr. Raza Khan. Thank you so much for your insightful and meaningful and fruitful presentation about the infection control. Really, it is a very knowledgeable presentation from your side. Really thankful to you. And if anybody have any question regarding this presentation, and if anyone uh, give us any feedback regarding this presentation, please raise your hand. I will unmute you, please.
May I, Mr. Naveed, please?
Yes, sir. Please, sir.
Thank you so much. Thank you. I'm glad to be part of TOG, and I would thank you, especially Mr. Naveed, Mr. Dr. Raza Khan, and especially Miss Adibisola, who is uh, founder of TORG, and who is provided us this platform for knowledge sharing. Uh, I would really thankful for Mr. Raza, and this was a very impressive presentation shared by Mr. Raza Khan. I hope 21% here would implement these knowledge who they got from here, and will implement at their organizations and departments to prevent SSI and all the knowledge. And thank you so much, everyone, for contributing here. Thank you.
Hello.
Thank you so much, everyone. That was an insightful presentation. Thank you, Dr. Raza Khan. Thank you, all our leaders, for organizing such a relevant presentation. As it has been said already, it's not a job of one person. It begins from the individual to ensure infection control practices are strictly adhered to in the operating environment, starting from hand hygiene to effective sterilization practices, to ensuring that appropriate PPE is worn, to ensuring that even policies and protocols that relate to prevention of infection in the operating environment are strictly followed, and to all other policies, evidence-based approaches, and it's a continuous assignment, and it's for everyone. It's not a job of one singular person, and all the teams, all the professions and professionals in the operating environment need to come together to ensure that not only in relation to patient safety, staff should be safe as well. As you are trying to prevent the patient from having surgical site infections. On the other hand, you are also protecting yourself from contacting those infections and taking them back home to your family. So it's a two-way system, and we're going to build up on that information that has been shared. We leverage upon that and ensure that we adhere strictly to infection and control policies and protocols in our environment. So thank you so much, everyone. Thank you to our Pakistan chapter leaders. Thank you to everyone that connected from all over the world. I want to say good morning, good afternoon, good evening, good night, depending on your time zone. And we're going to see you again. There's another webinar coming up soon on the global platform. There's another one next weekend on robotic surgery. And there will be another one for the chapter in another 1 month around the same time as well. Informations are going to be shared online. So thank you, everyone. Thanks for connecting. Bye and bye and bye.
Thank you so much. Thank you so much. I would like to extend my gratitude to each participant of your active engagement, question, and contribution. It's your involvement that makes this gathering meaningful. Thank you so much. Bye bye.
Yep.
Hello.